Hey everyone, it's Phil here again for Pioneer Podiatry. So today I'm doing this one live, so this is it, one take, it's got to work. I'm talking today about posterior heel pain, which is the pain that happens at the back of the heel. So we see a lot of patients who have heel pain under the heel, but it's different when it's at the back of the heel. So I'm going to talk all about that today. So if you have a big lump at the back of the heel, sometimes you can see it as a big, obvious swelling at the back of the heel. So that's the sort of patients that I want to give information to today. So there are two things we need to know with that, is that often we need to differentiate whether it is actually bone that is growing that's causing the lump, or if it's just the soft tissue that's getting swollen. So if it is, if it's a bone, then we have to treat it quite differently to swelling, just soft tissue swelling. Now, when people come in and say that they have pain at the back of the heel, it can be from two different reasons. It can be from actual pressure from the shoe. So this will be guys that are wearing work boots and they put their boots on, and that pressure from the heel counter, that hard bit at the back, is just pushing and causing a lot of pain. So that's one reason, shoe pressure. The other kind of heel pain that we see is pain that's due to when you actually go to push off and your Achilles tendon is pulling at the back of the heel. So these are people who get pain. The more they walk, the worse it is, or they might get the pain after exercise or sport, or at work climbing ladders and that sort of thing. So there's lots of different reasons why people get the pain there. So probably the most important thing to explain is that if you are getting pain at the heel, there is usually some biomechanical reason for that. So biomechanical means bio, the body, and mechanical means the mechanics or the movement of the body. So we'll often see people who have a high arch where the foot is tilting out, or a flat foot where the foot is collapsing in. And that means that the Achilles tendon, as it comes down and grabs onto the heel there, it's not pulling in a straight line. We've got torsion either in or out. And that's not good, because you're going to get more tension on one side than the other. The other thing we notice too is people who have a lot of tightness in the calf muscle, means that tendon pushes a lot harder at the back of the heel. Now, over time, you can actually start to see a bony growth come out of the heel. So this picture here demonstrates that. So you can get a spur that will grow, or you can actually get calcification in the tendon itself. So it's all very good to talk about the different ways, the different kinds of heel pain that there are, but the most important thing for you to know is that we have a lot of treatments we can use to fix it. So the treatments we use will depend on why you've gotten pain in that area, okay? So if you've got it because your foot is moving in or out too much, then we address that. And as podiatrists, we do that by addressing muscle tightness and weakness, and also we'll often look at adding something under the foot to support the foot, some sort of orthotic device. That's really real common way that we treat it. If it's due to soft tissue inflammation, then we use techniques to reduce that inflammation. We've talked many times about shockwave therapy, because we use it so much on chronic degenerative tendons and fascia and ligaments. So we use shockwave therapy a lot for pain in this area. If people have pain in this area, they often have it further up in the Achilles and up in the muscle as well. So they're just some ideas. Other treatments we will use are things like dry needling acupuncture, and many different treatments. So so just a shout out to anyone who is getting heel pain, back of the heel pain, whether you've got a big swelling or not. We'd love to hear from you. If you do, tag someone that you know, or yourself if it's you, and just send us a message. But we're here to help, and we'd love to. Okay, thank you for watching. It looks like I've survived a live video. Bye.